Hi, and welcome to K-Pod, the podcast about Korean Americans in arts and culture from Korean American Story. I'm Juliana Sohn, a photographer.
And I'm Catherine Hong, a writer and editor.
As listeners may know, for this season of K-Pod, Catherine and I are doing a special series where we're discussing cultural topics with the help of experts. Today's episode is about Hanbang, or traditional Korean medicine. We'll be talking about everything from acupuncture to herbs to cupping with our two experts, Dr. Erin Lee, who practices in Manhattan, and Dr. Robert Lee, who practices in Little Neck and Syosset, New York, and whose home we are recording from today.
Erin Lee is a doctor of acupuncture and Chinese medicine and a licensed acupuncturist. At Work in Progress Acupuncture Studio, where she's the founding clinic director, Dr. Lee specializes in acupuncture for the treatment of musculoskeletal pain and dysfunction. She also treats GI disorders, mood disorders, sleep issues, migraines, and allergies using a combination of healing modalities including cupping, gua sha, and herbal medicine. Born and raised in New Jersey, Dr. Lee is a graduate of Pacific College of Oriental Medicine and has worked at Mount Sinai Beth Israel's Oncology Center and NYU Lutheran's Neurological and Orthopedic Rehab Center, among other places. Robert Lee is the founder of Robert Lee Integrative Chiropractic and Acupuncture, where he specializes in sports medicine. Dr. Lee was born in Seoul, moved to the States at age 12, and after college at Stony Brook University, worked for 8 years as a respiratory therapist at Long Island Jewish Medical Center before he decided to commit himself to studying Eastern medicine. He obtained a master's degree in Oriental medicine at New York College of Health Professions and later a doctorate in chiropractic at the University of Bridgeport. Thank you both for coming to K-Pod.
Thank you for having us.
Yes.
How did you both get involved in your work? Why Asian medicine versus Western medicine? And were you ever interested in medical school?
For me, I was first introduced to it. My father, when I was maybe in high school, college, my father learned from a Korean acupuncturist. I remember seeing drawings from his notes and with the little dots all over it and just being fascinated by it. But fast forward more than a decade later, I was always searching for what my calling is in life. And here I am. I never really had an interest in Western medicine before that. For some reason, I was just drawn to Eastern medicine. I don't know. I just find it philosophically beautiful. It's more like an art form to me.
So my case is a little bit different. I was born and raised to be a doctor, just like all other Korean Americans. So as I'm studying the Western medicine, getting ready to go into the medical school, I decide to, why not just let me just get a taste of the Western medicine by becoming a respiratory therapist first. And as I was working in the NICU and the PICU, it was kind of harsh in my end. And I was thought of why am I being here? 요즘 말로 한국 요즘 말로 현타가 온다 그래요. Meaning you just realize what is really going on here. Am I really suit for this kind of role? Working in the hospitals, and then I always have connection to the Eastern medicine where I always get the help from whenever I have an issue with my body. So it's like,
so your family, you had a history of using Eastern medicine,
right,
just like Erin's family did.
So as I was working, and I was like, you know what, Mom, I'm just gonna turn around and become a 한의사 instead of a 양의사. And they're like, what? Just like what Erin said, the calling. There was a calling. Just one day, it's like, all right, Robert, you're gonna be an acupuncturist. I'm like, okay.
Maybe we should talk about terminology because I don't think I'd ever heard the term Hanbang, which I understand is the umbrella term for Korean medicine. I've heard of Hanyak, which I guess is the medicine itself. But can you just explain the terms?
So basically, Hanyak is just like the yak, meaning medicine, is there. So when they're referring to the herbal medicine, we call it Hanyak. Hanbang is, like you said, umbrella term, meaning all the East Asian medicine as a whole. They call it Hanbang, or they call it Hanbang 치료. The Eastern medicine treatments, such as acupuncture, the cuppings, the moxibustions.
Sorry, what's the last one?
Moxibustion
What is that?
Basically it's an herb that you burn on your body.
And Koreans know it as soup. So
숙뜸.
they put it in tok and all that too. Mugwort.
Do you know about that?
I only know about that because Dr. Erin sprays mugwort on me.
Spray.
Yeah.
Right. We should
I
mention
come
that
from
Juliana
an
is a patient of Dr. Lee.
Yes.
Right.
Dr. Erin Lee.
Dr. Erin Lee, right. Juliana has been a patient of Dr. Erin Lee. That's how we found Erin. Say again the name of this.
Moxibustion.
Moxibustion. They call it in the Western world, right? Moxibustion.
Moxa for short.
So all the modalities of the Eastern medicine is they call it it's Korean medicine. They call it Hanbang.
You know,
Yes.
in researching to speak with you guys, when I Googled Hanbang, every single citation in Google was about Korean beauty. And I think that people Googling this come up with a misunderstanding just because of all the marketing. It's all about beauty.
Everything's
and the
about
answer is,
K-beauty
what
now,
is
right?
Hanbang? It's Korean dermatology. It's the beauty. It's beauty, beauty, beauty.
I mean, nowadays
funny how-
the Korea is actually working really hard to promote who they are because such a small country.
Yeah.
So I think they're now calling K-pop, K-drama. So even the Hanbang they call it K-medicine. And big portion of the Korean traditional medicine is the facial rejuvenation. So they use a lot of herbs into the creams and other products.
So can you explain a little bit? I know this is a whole semester's worth of Korean medical school, but the origin of Hanbang?
So origin of the East Asian medicine, that's why they actually changed the name instead of start calling the TCM traditional Chinese medicine. But however, it started in China, obviously. But even the old text, they always refer acupuncture came from the East. And I don't know, you guys know the 벽화, the tombstone. They have drawings, and in Korea, the peninsula, they found a lot of stone needles and other stuff that thought that it could. They actually in Korea, they're claiming that the acupuncture came from Korea, but that's just a claim. So Hanbang is the traditional medicine is definitely shared with East Asian countries, China, Japan, Korea, even to the India, and then Joseon Dynasty. That's the one the Korean medicine got 더 커졌, more advanced, I guess, because of the work that the royal physician named Hejun, who came out in a lot of K-drama. So he's the one who wrote the encyclopedia of the Korean medicine and called 동의보감. And ever since then, the Korean medicine got evolved in such their own way of medicine because of the resources different than what Chinese medicine, and the herb is different than what they have than in Korean peninsula have.
So just to clarify, so there is a book. It's actually a series of books
Yes.
now, right? Called 동의보감, and that is like the Bible of Korean medicine. It's
Right.
still taught today.
Yes.
Has it been updated? Is it something that's continuously updated, or is this the original text just translated?
Original text is translated, and in Hanbang, in Eastern medicine, one of the professors actually, his quote, 한방은 오래되고 더 오리지널일수록 더 좋은 거다. Western medicine is more of like they keep on advancing it. Even the research, they constantly changing their findings. But the Eastern medicine is more of like finding the old way, and because of the medicine is based off the theory and the philosophy of the universe. So
even the formulas that are used today, they're time tested for thousands of years that have been around for that long. So, as opposed to constantly evolving Western medications that are coming out and for every new disease, and so I think in Eastern medicine they value, I guess, the tradition,
That's so interesting.
All of them.
That was a big question I had. Has it changed? So there isn't this idea of advances.
I mean, there are advancement of Korean medicine in terms of using different tools, not just the acupuncture needles. But now there's nano acupuncture creams are out there. Different equipments are very advancing. But I think the whole thought of formulating the acupuncture treatment points are still traditional.
So I have a question. Everybody's seen the posters or the 3D model of a human, and it's got all these dots, which are those the meridian points? Yes. And for me, who did not know anything about acupuncture, I equated those dots with every human. Everybody's different, but we have those points, and it's the job of the acupuncturist to figure out where those points are on everybody's body, and you need to hit that meridian point with your needle in order for healing to happen. And that's what I thought and acupuncture was. But when I started getting treatment, Dr. Erin, explained to me how acupuncture works, what the e-stim does, what cupping is, and why gua sha works. And I wondered if you two could explain actually what's going on, when and how you decide where to put the needles, and the actual biology and science behind it.
Okay. Let me ask you a question. You know why we use metal needles? Because it's a conductor. Our body have this thing called electrical field. So if Erin is closing eyes and someone's coming nearby her, she will feel that someone is approaching her, because we do have an electrical field around us.
So you can feel that someone is behind you, right?
That's not a heat thing. That's an electrical field thing.
It's an electrical field.
Interesting. Okay.
Our nerve is electricity. Wherever there is an area that is the resistance building up, we call it trigger points, or we call it action points. You can call it whatever, but that point we put a needle in, and the electrical current has to flow nice and smoothly, but there's resistance, and because of the needle is a very good conductor, you put it in there and it will lower the resistance.
Oh.
I think of it as the same way. Acupuncturists are basically electricians and plumbers for the human body. You're looking for where there's blockages, where things are stuck, things are not moving properly, and that needle removes those blockages and gets things flowing. So that gets rid of inflammation that may have built up, pain. But what I always explain to my patients is that the needle, when it's inserted into your body, it's causing a micro trauma. So just like a paper cut, your body is going to go check it out, send white blood cells there, anti-inflammatories, and it's going to heal it. So it's basically stimulating your body's own healing mechanisms.
So it's a body reflex. Body will recognize the invasion, and then body react to it.
Like it's being attacked, basically.
Yes.
And then cupping?
Cupping is basically you generate the space in between the fascia and the skin. And again, blood surge to the area where they think, oh, wait a minute, there's a space. What's going on over there? We need to feel that space. So you have that red marks. So because of you improve the circulation or blood into the area, that you have this effect of healing because of the blood. You're drawing the blood into the area.
So I'm not shy about walking around with like a strappy top with my cupping marks, and some people get freaked out because they think it looks like bruising, Can you talk about, is it bruising? What is it?
Little bit different than bruising. It's a micro trauma to the. So it is a bruising, but it's not.
It's different from a bruise because
Yes.
the vessels are not being broken, though. That's the blood being brought up to the surface.
Oh, that's why you don't get the super yellow discoloration.
Right.
So the marks and how dark it is are diagnostic. Usually, if it's really dark, that's where usually that person has pain there. That's where it indicates poor circulation. As you keep doing cupping, each time should be less and less in terms of the severity of the marks. And the goal is to have no marks at all, and that's healthy tissue, healthy circulation.
When Koreans started immigrating to different countries, everything kind of evolves when you're diaspora. Like, do you think there has been an evolution in Hanbang in the States because of immigration?
I mean, I don't think there, in the United States, in all major Eastern medicine schools, they're teaching traditional Chinese medicine. That's where the original text came from, 5,000 years ago, or the original text. And then you can kind of specialize and go off into Korean. Japanese has their own style too.
I'm wondering because I know so many of these stories are like, oh, there's a harabaji who's 80 and he practices out of his home. And I'm sure he's not licensed, or maybe he learned it, but maybe he didn't go to, study in a proper college or university. But they all practice it. So I guess that's what I'm
So I think
wondering
you're
about.
more of, how's the system, the medical system got evolved, right? The immigrants, when they first came here, I'm pretty sure they don't have the right access to the Western medicine. So maybe, to me, the first immigrants, they're more hang on to their folk medicine. So they're actually practice the folk medicine. And I'm pretty sure there's, in such as San Francisco, there's a ton of Chinese medicine clinics out there. I think what you're referring to is have these Eastern medicine system got evolved? Yes, because the licensure, here in the States, they recognize the Eastern medicine more and more. We're not quite yet there yet to become a mainstream of medicine, but more people, American people, recognize acupuncture.
It's integrative medicine, which is becoming more and more embraced. And I think it's more accepted here now in Western culture than it is with Korean Americans or, Asian culture.
Yeah, for instance, I never knew what cupping was until I saw, like, Gwyneth Paltrow and Angelina Jolie. I had no idea
Michael
what that
Phelps
was.
made it
I'm
famous,
learning about
right,
these
with
things
cupping.
from, like, trendy
Western
celebrities.
Yeah.
I wanted to read. We put a call out for questions from listeners, and we got two that are kind of an interesting snapshot of the perceptions. So one is from a listener named Tina Kim. Hi, I'm a Korean American. My question is, why are so many Korean Americans so negative about traditional medicine? When you get into the nitty-gritty, our medicine is not only beautiful, everyday modern science proves our traditional theories. What can we do to help promote our traditional medicine to be seen in a more positive light by our fellow Korean American peers? Then we have another question from Sean Yi saying, why does Korea still seem to hold on to the belief that traditional Korean medicine is just as valid as modern medicine? Is there actually any sort of scientific proof regarding this? So there you have it. One person saying Korean medicine is beautiful and it needs to be more respected. And the other Korean American is saying, what the hell? Why are we still...
And I think those two questions back to back are so emblematic of the attitudes of a lot of Korean Americans. It's so split and polarizing.
It's interesting to note that historically, though, during the Cultural Revolution in China, during that time, they banned Chinese medicine, Eastern medicine. A lot of the practitioners, they were prosecuted. A lot of the good, practitioners came here and are in the States now. They burned thousands of years of medical texts. But I think, they did that because they wanted to seem more advanced and embrace Western medicine.
I think the first question is they have that perception because of the Eastern medicine still recognized as a folk medicine. So I think that it ties into that both questions because it's great, but everybody practice without license. But matter of fact, it's not. Even here in the States, or when in Korea, is definitely is one of the top achievement become a hanisa. They're really well off in Korea. Even here, I mean, we've been practicing and with the license, with proper training, with proper education. So this is actual field of profession.
Also, more and more it is becoming more accepted in Western or in the US, but it's also legitimate in that insurance companies are more and more covering it, which they don't cover experimental procedures. They cover acupuncture because it's scientifically proven in clinical trials.
And there are a ton of research paper out there. So
that was
Right.
part of the second person's question is what is the evidence? And I know I've heard about clinical trials in acupuncture. I don't know much about herbs. And I do wonder about, are there large-scale clinical trials? Are there...
Believe it or not, all the old text is a collection of the case studies. All the text that we learn from is actually the collection of the research papers.
But couldn't we have modern tests doing
and
that
also
now, right?
in the
Randomized
institution,
controlled trials. Are they doing that in
yes.
Korea and here too?
Yeah, absolutely.
I think you can maybe tell from, Catherine's line of questioning and my line of questioning that I'm much more of a believer in integrative medicine, and I'm actually a patient who's being treated. And Catherine, as the daughter of a Western doctor, is much more skeptical. And I think it's interesting that, some of Catherine's questions, it's forcing a Western standardization, like measuring tool on Eastern practices. And that's the only legitimizing kind of standard that they know. And there is, even with a lot of our other questions, like, how is it legit? What's the difference between superstition and science? And there are a lot of things that I believe in, but then there are a lot of things that I still question as well. I had a conversation with Dr. Erin in the car, and I'm going to read one of these questions because I have to say, I thought, that's even maybe hard for me to kind of really get on board with.
Hi, my name is Kyunghee Kim, and I'm calling in from Michigan. My dad is a practicing herbalist and acupuncturist for 35 plus years. And I honestly 100% believe in Hanyak and acupuncture because of how it has worked in my life. A question that I have, just a very silly one, is what is your take on some of superstitions around Korean health things? Like my mom would always say, don't leave the fan on when you're sleeping because essentially you're going to die. And although I know this is completely not true, I do not leave the fan on when I go to bed. And then another thing my parents would do is when I would have indigestion, she would poke my thumb with the needle and gather all this blood from my shoulder down to my thumb and essentially get bad blood out. I felt like it worked, but I don't know if that's just me being superstitious, and I'm wondering if you know anything about some of these Korean superstitious health things. Thank you.
I think it's a language. You guys had a previous podcast. You guys did a linguistic, right? I think the Korean medicine to the Korean younger generation, and I think it's a language. 몸에서 독을 빼는 건 아니고 bad blood을 빼는 게 아니라 그냥 그렇게 설명을 하기 쉬우니까 그렇게 했던 거예요. 옛날 분들은. 그리고 한의학도 그런 식으로 설명을 많이 했던 거고. 근데 when I'm dealing with the non-Korean patients, I have to actually answer these type of questions in a medical way.
You don't say bad blood.
No.
You don't use that term, right?
No,
because people think
right.
leeches.
Exactly.
They think this is
so
medieval.
I think it's a language issue.
Well, I think also it's a little bit of ignorance because, like you said, it wasn't widespread with Korean, say poorer people in Korea even before, Dongulbogan came out, and people don't know the true, reason behind why they do things. They're just told this is something you do at this time. So I think that's why, it gets passed on as folk medicine or superstition.
Well,
but there's reasoning behind all of that.
That's a superstition.
Well, not found out, but I was explaining to her in the car about how, you don't want to sleep with wind blowing on you.
We call it evil chi, the wind. You always have to watch out for the cold. The wind is blowing at your body because the body will respond to the different temperature, different gradients temperature, and then your body react to it. They just make it a little exaggerated so that the people don't practice like sleeping with the fans on. But I don't think you'd actually die from it.
Okay, so I was telling Dr. Erin on our drive out here that I got my mom one of those headphone things that is a neck fan to help her so she doesn't overheat when she's doing her daily walks. And Dr. Erin said something that I thought was like, that doesn't sound based in science to me. So can you please share that?
Well, I was telling her that I don't think it's a good idea to have a fan on your neck blowing wind directly at your face, all the channels on your face. Mm-hmm. Because Eastern medicine, the reason why it may seem like folky or superstitious to people is because it's based from observations thousands of years ago, based on nature, based on 5 elements, wind, fire, earth, metal, things like that. It's based on observation on what those cause in the body. So with wind, things like wind hitting the body, you'll see, clinically things like Bell's palsy or stroke or headache or dizziness.
Those language or philosophy itself is very, sounds like non-medicine, but 그게 진정한 그 의학인 것 같아요. 그러니까 우리의 몸을 설명할 때 when we are explaining our body, Western medicine talk about in the cellular level. The Eastern medicine talk about the universe, how the universe is made, how the person is born and die, how the season pass. So Eastern medicine adopt the phenomenon of the universe and apply to the health of the human body. So it may sound like, that's not a medicine.
It seems more philosophy based.
Oh, it is very
when you
theory-based.
when you say
the medicine is based in philosophy, but it's but clinically brought to the individual. But it's interesting because the Eastern medicine it does have more of a macro view, whereas Western medicine I think has more of a micro view, and that's why there's so many different specialists. If you hurt your hand, you go to a hand specialist. Your foot goes to a foot specialist. Whereas Eastern medicine takes it more holistically and treats everything at once.
So maybe that treating the whole A to Z treatment maybe not acceptable to a couple of the public. So they may have those kind of question because of that. I think we do have our weakness in a certain way, but however, traditional Eastern medicine is surviving for a reason.
Now we have another listener question. This is from Sonia Hong. She emailed us saying, is there any intersection of Western and Eastern medicine, i.e., are there concepts or practices that they have in common? Are there practitioners of Western medicine who also incorporate Eastern practices? I feel like this would be the best of both worlds. So I love the first half, especially. Are there basic tenets in common?
I mean, it's a medicine. We're dealing with the human body, so that's the commonality. It's just that we speak in a different language. How to describe the conditions may be different than what Western medicine is recalled, and they categorize by putting into diagnosis and as if this is the only diagnosis you have to use. But we call it qi deficiency. We call it blood stagnation. So it's just a language barrier, I guess. But the commonality is we're dealing the human body. So that's the cross bridge, and now it's more like a turf war right now is going on. That the Western medical doctors, they want to be part of, they want to practice acupuncture by calling dry needling, and then I'm pretty sure the Eastern medical practitioner here, we want to practice more of a diagnostic medicine, like practice, like maybe taking X-rays or something. I'm pretty sure there is some degree of
overlap,
integration.
Yes.
What do you think, Erin?
I think it is completely just a language difference. Even with the and the commonality is the human body. But if you look at acupuncture meridians that were, put into medical texts 5,000 years ago, they follow major nerve pathways. So we might call it a meridian, but in Western medicine, it's the nervous system, right?
Nervous system.
You mentioned like a little bit of a turf war or a battling. So I'm curious, in your own lives, Robert, you're the father of a 5-year-old girl.
Yes, Isabel.
In your treatment of her, or in her life, does she go to a pediatrician, like a Western medicine pediatrician? Are there in your own life, do you go get a checkup, and who do you see?
Just giving my little bit of health conditions, just share my health conditions. Recently, I had a really bad liver enzyme was a little high, and all that because of stress. And
How did you know that?
because I went to the Western doctor to get, as an annual checkup, and the blood test results came out, and it was a little bit elevated. And their approach was, because my ferritin was really high, and one of the treatment for that is bloodletting. Yeah, actually, they suggest to go to a blood donation center and donate blood.
Wow.
So we as an acupuncture, we have a perfect technique to bloodletting. So because cupping, they're called wet cupping, meaning that we suck the blood from the body, but you're using the negative pressure.
Do you make an incision in the body to let the blood out? Like
a puncture.
Yeah.
Yes. You right? Yes, yes. You have to, not incision, but we use a lancet, just puncture. So I went to my colleague's clinic and told what's going on, and I went there, and every time, can you just get the blood out as a part of the treatment for myself? So yes, Western medicine will still go first, definitely for.
In that case, you had maybe a little bit of a diagnostic test, but you treated yourself. You figured out your own treatment.
I mean, there was a suggestion,
Right?
And then instead of going to the blood donation, and I actually got treatments for my back, and I can actually get a treatment for my the muscle stiffness at the same time. So the Western medicine is really strong in, I'm pretty sure they all agree as well, Western medicine is really strong in diagnostic medicine, emergency medicine, and surgical medicine.
What about infectious diseases? Like antibiotics, things like that.
Right. So the infectious disease control, infectious control, 그거는 우리가 가서 하면은 좋을 것 같고, Eastern medicine은 we're more of a preventative medicine, wellness care, and as well as treating the symptoms and treating the conditions as well. But so they're known for that. So to me, I'm bringing my daughter for that reason, just to find out, if there's anything wrong with her. Emergency, such as high fever, all the kids have it, right? Then we have to bring to the emergency room because it's quick release, a quick treatments. I'm not gonna give her needles for when she has 110 degree. Right. I'd rather put ice on her and give her antibiotics or anything that is necessary.
Got it. What about you, Erin? How do you balance in your own life or in maybe family members?
I've always found that Eastern medicine can treat about 80% of things before you need pills or surgery. It's treatable, preventable. Like you said, Western medicine is great at acute care, surgery, emergencies, traumas, things like that. The difference between Eastern and Western, one of them is that Western medicine looks at disease as all the same. For example, someone has diabetes, high blood pressure, you're pretty much given the same. Everyone gets metformin. Everyone gets, the same drug. Whereas Eastern medicine, you can treat it based on why you have that condition. So I think most things are preventable and treatable with Eastern medicine before you need to go to pills or surgery.
Well, depending on the ailments, I think generally Eastern medicine tends to feel less invasive. The reason that I was introduced to Dr. Erin is because she treated my father, who had spinal stenosis. His Western doctor had said that there was nothing that they can do, it's degenerative, and he was getting spinal injections to mask the pain. And it was kind of hit or miss. Sometimes they would get it and sometimes they wouldn't, and then he would have to wait 3 months if they missed the spot for insurance to cover the next dose of getting a shot. And so he had to sit in pain for 3 months waiting. And so he got treated from Dr. Erin, and he felt great the next day. He said he felt lighter, he slept better, and this was somebody who had been told that there's nothing that we can do for you. I thought it was really interesting that one of the comments Dr. Erin had said was, the more Western treatments, like these shots, these steroids or whatnot that you get, the harder it is to get integrative treatment because of the disruptions, I guess, that your body has already gone through. And I wondered if you can maybe talk about that.
I know a lot of the times when patients come in with back pain, they've had surgery already. There's a lot of, that's trauma to their body. They have a lot of scar tissue, a lot of adhesions down there. So it's just harder to treat when there's other structural issues going on, when they've had other things already before they come.
And also the Western medicine with medication, it actually disrupt the, inner balance or
for internal
the
conditions.
internal conditions. And that could also make our treatment harder. But however, people do come to the acupuncture clinics or Eastern medicine clinic as a last resource.
They've tried everything else.
But don't get me wrong. I mean, Western medicine will treat the structure accordingly. But when they come to our clinic with all these damages after surgery, all the scar tissue adhesions is already formed, it definitely is hard for us to unwind the condition.
Even for internal conditions, a lot of these patients are coming in on medications. And so we're fighting kind of against the side effects of those medications as well.
A lot of patients are using multi-drug because to treat side effects.
I see.
Not only to treat the main cause, but because of the side effect of it.
The nausea.
So, Have you ever had a patient come in, you saw what they had, and then you thought about it and you said, I suggest you see another type of doctor? Has that ever happened where you send them to
of course.
an oncologist or?
I'm a chiropractor as well. So I read MRIs and the CTs and X-rays. And if there's a tumor that all the other orthopedics Western doctor missed, obviously I have to send them back.
A surgical thing. But what about a non-surgical thing?
Under what conditions would you send one of your patients to a Western?
Emergency case, meaning for sure there's a stroke is coming. The patient is showing those signs. People come in for the pain, but yet people will show those emergency, the red flag signs. Obviously, we need to definitely draw them to the Western medicine, and not because of the actual help that they can get from them, but also the legal aspect as well. Eastern medicine, we're still not really protected by the system, I guess. So if we miss those red flag signs and still treat them, the conditions that they came in, but yet the red flag signs are there and we missed it, is a big no-no for us as well as the patients. I actually did send out my patient a couple of times, matter of fact, whenever I saw there's a sign of stroke and bleeding, signs of internal issues, an emergency case, and right away you have to send the patient to the emergency rooms.
You made a comment earlier about turf war between Eastern integrative medical practitioners. I have noticed people using terms like long needling. Somebody said to me, I had a pinched nerve, so I went to my physical therapist who did long needling on me. And I said, what is that? And they described acupuncture. And I said, well, isn't that acupuncture? And they said, oh, no. Acupuncture only goes really shallow. And, this goes really deep into the muscle and whatnot. And I thought, I wonder what Dr. Erin would say about that, because that doesn't sound right. And when I mentioned it, Dr. Erin had said people are trying to rebrand, repackage Eastern medicine for people who may be biased or don't believe in Eastern medicine. And they're using different words and calling the same practices different things. I wondered if you could talk about that going on in America.
Those are our daily 맨날 겪는 거예요. Patient comes in and they're going to physical therapy and they're doing Juliana needling.
Yeah.
It's acupuncture.
Trigger point
Trigger
therapy,
point,
releasing muscle, fascia. Anything with a needle is acupuncture. And that's written in medical text from 5,000 years ago, where, they're looking for these tender spots. In medical text, it's called asha points. Or I don't know, Korean medicine, but they're called trigger points in Western medicine,
right?
And that's what they're needling. But they rebrand it and call it dry needling.
AMA. No. It's been going on since the acupuncture was introduced to the Western world, and that's how the Western medicine become huge, because they slowly
Absorb.
What's another example?
They're not observed yet, but the osteopath deals are observed by the Western medicine. And another example, the word the cupping. You know how the new cupping they call it?
Mm-hmm.
Myofascial decompression therapy. So they're coming up with this new terminology that sound like more acceptable to the Western world, and they just claim it. And this is physical therapy. This is manual therapy, and this is a myofascial release technique.
But I mean, the good thing is, though, in New York, that dry needling that was done by PTs who took a weekend course to be certified to do it, it's illegal now in New York. Right. So only licensed acupuncturists can do it. Right. So it was recognized that it's acupuncture,
We wanted to ask practical advice and questions about treatment. We have a listener question from Kevin. And his question is, I wanted to ask, what are some things to look out for or ask when trying to find a good acupuncturist? Along with this question, I've had some people ask me, are acupuncturists real doctors? How do you know somebody has a license, and what do you look out for besides like 400 hours of treatment over a weekend or something like that? What should they be looking for?
They definitely need to look for the paper on the wall says licensed acupuncturist.
And who licensed that? New York State?
New York State.
Yes.
Okay.
Just like the USA, every state have their licensure policies, I guess, the system. So you need to be licensed, meaning that you need to pass the national exam to become an acupuncturist.
There's several board exams you have to pass.
Yes.
It's a 4-year school of program, It's not something that you can do with a weekend course.
So if you're a licensed acupuncturist, that means you've done the 4 years?
Yeah. In the States, it's a 3-4 year program. You can be a licensed acupuncturist and go a step further and get a clinical doctorate, which is the same as, a chiropractor or dentist or anything like that. So,
I mean, even a medical doctor, they're a doctor, but they're at master's level.
Mm-hmm.
There's the same educational level, I guess.
4 years and you get licensed, but you don't get to call yourself a doctor.
Depends on which state you practice. So such as state of Florida, they call it acupuncture physician in their license.
Mm-hmm.
So they're doctors, they're physicians. Which other state is it? Colorado, I think they're calling as a doctor of Oriental medicine. So in their license, they have that title, the credentials.
Mm-hmm.
So the 50 states, all different credentials.
Okay, so that seems problematic.
Yeah, New York State is called, with a majority of states, it's called LAC, licensed acupuncturist.
Okay, so Dr. Erin, you did the extra 2 years to get the doctor, correct?
Additional year.
Additional year. But if you hadn't, you would be
just a licensed acupuncturist.
Okay.
I don't think that's any distinction in how you should choose a practitioner, though. There's plenty of people that have been practicing, even become a doctor, getting a doctorate degree is a fairly recent, past few years it's constantly evolving in the United States. So it's something that was only even introduced a few years ago. So there have been people that have been practicing for decades, but who choose not to go back to school to get that doctorate. So,
Okay,
So what would you look
yeah.
for? Tell us.
I would choose, the way I choose anything in my life is by reviews, whether I'm shopping for something or any healthcare practitioner, look at all their review, Google reviews, Zocdoc.
Yeah, that's a current generation method of finding a good doctor, I guess. But however, what I'm trying to mention this is the Eastern medicine is like it's a skill, it's a language, and more experience that you have, better you are. Although the information itself is not changing, you need to look for the practitioners who have enough experience. I think that's a good way. I'm not putting the young new practitioners down, but it is kind of hard to introduce someone who's good because we don't really claim as a specialist in a certain aspect. But that's more of the Western view of the medicine. But however, it's maybe Erin's different than what I believe, but the Eastern medicine should also be specialized in certain fields of medicine.
They do that in Korea, don't they?
Yes, here in the state, the practitioners like claiming even like next door where I am, there's a clinic for Chinese medicine for infertility. So they only do infertility works. Then if my patient comes in and they're looking for the infertility treatment, then I will just refer to them because I'm a more considered as a pain management. So I think that's the way of evolve ourselves to be more recognized as a specialist in a certain field of medicine.
In researching this episode and looking for practitioners, we found a lot of practitioners who went to Pacific College, and both of you have trained there or done teaching there. That school just kept coming up.
There's a lot of great schools, but Pacific College is one of the largest in the United States. So they have 3 campuses in San Diego, Chicago, and New York. But the reason why I chose Pacific College and where I think they excel is that it's a 4-year program, like I said, and half of that is biomedicine. So you have a good mix of Western and Eastern education there.
Okay, so that's another thing, maybe listeners, just to know the name. Would that, I don't know.
Like what are
Robert? What do you think?
What are some good names of
hard,
schools? Like
things to grasp
a marker.
근데 이게
Our listeners need help.
이 한의사들이 왜 한의사냐면요. 우리 한의사는 안 보이는 거를 다뤄요. 그러니까 the key. 그리고 한의사들 자존심 되게 세요. 누구한테 가더라도 다 자기가 잘났대. That's the problem. But however, 그러니까 살짝 농담이긴 한데 Eastern medicine 저는 항상 그래요. 일단은 just try anyone.
Okay, someone needs to translate what I just missed.
So they have a lot of Korean practitioners. They have a lot of pride. They all think that they're the best, right?
Because you were dealing with something called qi, it's invisible.
A lot of it is based on intuition and how good you are.
I mean, this goes into one of our other listener questions. Referrals. This person was a great acupuncturist. They work for me. Sometimes that acupuncturist won't work for somebody else.
Exactly.
I think, was it Sonia's other question?
No, Kevin.
Oh, Kevin said, hi, my name is Kevin, and my question is, as someone who has done acupuncture before and was unsure what I should be feeling, what other signs that treatment is or is not working? And Sonia had a question where she said, I was treated for, I think it was hot flashes and insomnia for about 3 months. Couldn't tell if it was just because the treatment took 3 months, if it was a natural progression of the treatment, or it was just that she was going through her menopause cycle. It was a placebo. She couldn't tell. And so does acupuncture work for everyone? Is it really a matter of, you said shop around?
The reason why acupuncture can't, fit into the Western model of being into that scientific method is because Eastern medicine, acupuncture, looks at every individual differently. So everyone has a different reason why they have certain symptoms or conditions. And so they're treated individually. So, you can go to 10 different acupuncturists and they might be treated with different points, different prescriptions from each of those people.
But then is there a right way?
But another difference is where they might have gone. There's a lot of different ways to practice.
Okay.
So you and I talked about
Yeah.
it, but there's community practices or individual one-on-one, and you may have different results from going to a different type of place.
Yeah. So this is something that I learned that I did not know before. When you think of acupuncture, thousands of years old, it seems that there are different ways of practicing and different modalities. Is that the right word? I thought, is it like yoga? Everybody does yoga. But then when you start doing yoga, there's, hatha, there's Iyengar, there's Mysore. And there are so many different ways of doing it that if you don't know anything about yoga, you're like, what? Are there different styles of acupuncture?
I think I need to clear this out a little bit. But by rewind all the information that we shot out for the past 30 minutes. The Korean medicine is a form of medicine where they do have clinical practice guidelines, so that certain conditions you do this way, certain ways. Regardless of who you are individually or different, there's a certain herbal formula that we prescribe for the certain conditions. It was all proven through the case studies, the long years of case studies. Going back to the question, we do kind of practice in the similar ways because of that, the way we learn and educate ourselves. So rather than using the acupuncture, I may prescribe the herbal medicine for the patient. So it's just a practitioner's choice. But
there's so many different ways to treat a patient.
Right.
There are a lot of different styles of acupuncture, not just in herbal, but some people I was explaining to you before, a lot of times in, say, a community setting, you're limited. You're lying there with a bunch of other people in one room. And so the practitioner may only choose certain points that they can access on your hands, feet. They may not go local to treat back pain. Whereas some practitioners, for myself, I do go deep, I do trigger points, but there's other styles where other practitioners, they choose not to go local. They'll just choose distal points. So it may work and it may not work for certain people, but you just have to keep looking for the right practitioner for you because there's so many different styles out there.
There's no 100%. There's no cure. I mean, there's no one medicine that cure everything.
Mm-hmm.
So even the Western medicine, the research, when you actually look into their research papers, they always aim for like a 33% or improve. That is called significant change to this whatever they research on. Mm-hmm. So I always half joke by telling my patients, if your conditions get better in 50%, would you accept that? They say, of course. Even a 10% I ask that because how much pain that they have. We only can try hard to help them, but maybe the medicine that I understand is not perfect for that person. I cannot help 100 of them, 100% of all my patients. So maybe half of them can be helpful by Dr. Erin because of the different style that we practice. So that applies to Western medicine as well.
When my mom was ill with cancer, I know that her friends would come over and make sort of like this giant concoction of deer antler and mountain herbs. And I was never quite sure what was happening, but there was a giant pot on the stove at all times. And I think it did make her feel better. I don't know if that is a placebo effect or if there's some sort of valid reason why deer antlers have nutrients for someone who's recovering from an illness. Thank you.
Several people, when I mentioned we were interviewing Korean medicine doctors, they all said, what is the deal with the deer antler? So just tell me about that ingredient. What does it do? Where did the deer antlers even come from? Where did you find them?
How do you source deer antlers?
Yeah, and what is in them that makes them so powerful?
So it's an essence, basically. The animal's blood. They all 골수.
Marrow?
It's the same reason why now bone broth soup is so trendy.
But
and
why
big.
deer? Like there are other animals with antlers. So I'm just curious, is it the deer specifically?
They actually did a huge research on the why deer antler is so clinically effective. And interestingly, they found the deer that is from Russia or West is not so much effective compared to the.
They're different deer, right? There's deer in my backyard. I don't know if that would be the same as a deer from Korea, right?
So there are definitely this research out there, but which I cannot speak of, like because. But however, deer is the known herb for the people who's recovering from the chronic illness and long-term bodily weakness. So 녹용 is definitely the resource for recovering the health.
Weakness, just strength, general strength.
Strength building.
And so if one of you were to prescribe something that contained deer antler, where does that deer antler come from?
Now, Korea also have a deer antler farm that they cut the deer antlers and they make it as a herbal. They sell it to the practitioners. Many of also Alaska deer antlers is also important to the practitioners.
I mean, in general, though, those kind of things are not prescribed in everyday practice clinically. You know, they may be extreme cases. More and more practitioners are going away from using animal products here as well. So,
Interesting.
I mean, there are things that have been used historically, of course, and in certain cases, you would still use them.
You don't prescribe them very much, it sounds like.
Actually, I do as a 보약, meaning 한국 보약, Korean medicine 보약에는 꼭 녹용이 들어가야지 좋아요.
But what is 보약?
Like strengthening.
이것도 어떻게 보면은 웨스턴 메디컬이 생각을 하면은 보약 뭐 해주는데, but 우리가 보약을 주는 이유는 몸이 허할 때, 그러니까 약해졌을 때, 그때 보약을 줘요. 그러면 그 보약을 먹고 기운이 나고 힘이 나고. Just like 5-hour energy drink, but have an herbal product in it.
Yeah.
So he's saying when the body is weak, you want to give them a strengthening, tonifying.
So
Health
even
tonic.
the word tonics feels very old-fashioned. Right?
So the herbal medicine has big aspect of they use it for treatment for the certain conditions, and there's also in current medicine is big aspect where they 보약 like the tonic herb, such as the after delivering a baby that they give 보약 to the mom, such. So.
I guess it's not as common here in the U.S., but it's kind of like how bone broth is here. You would also use that for, blood nourishing or strengthening.
Or 미역국, right?
Yeah.
Yeah.
Can we talk about
question.
miyokguk? Because that was a question. Like, why do
New mothers eat miyokguk.
Seaweed is good for swelling, right? Edema, things like that.
Even the chemical aspect, the microcell aspect of the seaweed or kelp, that they're known for those aspect of improve the circulation, tonifying, or improve the because of the iodine aspect, the blood tonic. So the mom who just delivered a chunk of her body out of the system, and they actually bleed out, right? So just to nourish the actual blood loss, they give 미역국. And miyeok is known for that effect.
So is that considered hanyak?
Yes,
It is.
I mean, yes, to me it's a hanyak.
What, miyoko? I mean, so I think the difference between a lot of misconception also, I think, you and I were having this talk, Juliana, is that, Koreans grow up with certain foods and they think that's hanyak or like miyokguk, but hanyak really is herbal medicine, is a combination of different herbs that work together as a formula to treat certain conditions. Whereas if you're doing a single herb, it's really like anything else in Western nutrition, it's just food, So you're looking at it for nutritional value.
This is where it become the Hanbang. You can call it as a Hanbang. Everything is within the Korean medicine, right? But it's a folk medicine, right? So we eat certain food for certain conditions. 민들레, the
Dandelion.
dandelion, the cooling.
What's that for?
Cooling.
clears heat from the liver, and that's used in a lot of different herbal formulas, but it's never used as a single
But now
herb.
Korean eat as a kimchi.
Yeah. So you eat it as food, though, right?
So
In
that
cuisine.
become
I
folk
see.
medicine.
I
So
see.
the Korean medicine is really like in their life.
Embedded in the culture.
Yes, embedded in the culture. So that's why when it comes to the medicine, they don't really think of the Korean medicine as medicine.
I think that's why they're more dismissive of it, because it's already something that they're grown up with.
So I have a personal anecdote that I wanted to share and run by you two. My uncle, who is a priest in Korea, had a stroke, and he had a hard time recovering one side of his face and the muscle, the nerves, and he went to Hanbang practitioner, and he saw improvement, and because of that, he sort of like cast off Western practices, and he was on the hunt for some hanyak. And when I was visiting one year, he was like, the next week he was off to China. I was like, I want to go. So he actually took me along with him. We flew into Yunnan province. We took a 10-hour van ride up to Dali, and he was on the search for black bear gallbladder and tiger testicles. And
So why are you laughing? Do you think this is
this nuts?
Is this nutty?
Is this
Is
crazy?
it real?
I mean,
What's the deal?
we actually found it.
It is real.
We went into like a hanyak store in like this rural area, and my uncle was like, "We don't want this stuff." The priest and his secretary and his stained glass cutter were like, the three of them were on the trip. And they're like, "We know you got the goods in the back." It was like a drug trade. "We know you got the goods." I mean, I think tigers are on the endangered species. Yeah. And we got this money. Come back, in a couple of days, we'll find it. And there was a trade-off. And then they wrapped it up in plastic, taped it to their body. And we went through airport customs. I was younger. They didn't want me to carry anything. It was like a mission, a drug smuggling mission.
What's your take on this? These ingredients?
That's the older generation of who believes in the Eastern medicine, the Korean medicine. She mentioned it before, more and more we're going away from the animal products. Because the plant-based herbs, there are a lot of good herbs there can replace it. But however, the effects of it, obviously, I don't know, maybe their strong potency is very high. Maybe they're going after those
Is it
gallbladder.
real? Is it true? My whole thing is, how do you ingest it and digest it?
No, actually, they make it as a decoction. They usually intake with with other herbs, and they cook it together.
I see. Like you said, it's not a single herb or single ingredient. It's in combination with other ingredients.
If I'm not wrong, probably that's how they consume.
Most herbs are decocted or brewed, so that's how you get all the nutrients out of it.
Okay, that's a new word, decocted.
Decoction.
That's the extraction.
Yes, extraction.
Okay.
Yes.
Another question. There was a time when Korean people were all wearing these magnet bracelets. What is the deal with that?
Is that your question or a reader?
That's our question.
My parents wore them.
That's not Korean medicine.
What is that?
That's not Korean
That
medicine.
was a Chinese thing in the 80s?
Magnet
It was
bracelets?
very popular in the Korean community for a little while. Magnet.
Do you know that America, back about 100 years ago, there was a magnetic practitioner?
They were American.
Right. Just it's a business. It's a people in the business aspect. They came up with this product and they sell it, and they probably borrow the Korean medicine, the meridians, the effects of it, and because the language is so easy for Korean people to accept those, because of when they say, "Oh, this will improve your circulation. This will get your pain off from you." So it's just
Well, I think there's also, when things sound kind of crazy to us, it's easy to discount it. Like, where did this come from? But, just like acupuncture, Eastern medicine, if you don't know the theories behind it or why you're doing what you're doing, it sounds crazy, right? So now with diagnostics, modern medicine, they're proving in, functional MRIs at a certain point on the leg that was used for thousands of years for eye conditions. They're proving now functional MRI show that the optic area of the brain is lit up with that point. There's a lot of reasons that we use or do certain things that the public may not know. But the same with, magnetic bracelets. I don't know exactly, why, but I don't discount
It's probably
anything
based in something.
Because the whole
right?
body is an electromagnetic field. It's bioelectric,
And
If it's down to a cellular level, it's electrons, neutrons, it's positively, negatively charged.
And
So
interestingly,
it may have an effect.
those products, they actually applied into our so-called acupuncture points. So it is effective because of is stimulating those acupuncture points. Matter of fact, I do actually own a magnet product.
The truth comes out.
It sounded like we were debunking it, but now it sounds like we think it's legit.
But I have to be honest, because that's not a medicine. But however, they one that I was about to share with you. They make a cloth, but they have a magnet in a certain positions, and I wear it in the head and the taeyang, intang, and dutoni, pekher. So they actually borrow or they use the Eastern medicine theory or the meridian points, and they came up with this product, and they advertise, and this works great.
It's the same with those seasickness bracelets. The reason why it works is you put it on a major acupuncture point for nausea.
I see.
So, it goes
So
on
maybe,
the stimulant.
I see.
Yeah, but it was big. You're right. It was a big on like back in like 20 years ago. Yeah.
Thank you both so much for your time and expertise. We wanted to ask, as Hanbang practitioners, are there any misinformation out there that you'd like to clear up?
We are practicing a medicine that help the body. We're not practitioner who perform folk medicine. I mean, there is a 한국 수지침, the Korean hand folk medicine. We are separate from it. The acupuncturists, we do not practice 수지침, because that's more considered folk medicine. The Korean medicine or traditional Chinese medicine, the acupuncture, we do have our own distinctive system of understanding the human body and how we treat conditions and disease and so forth. It's a form of a medicine that you can trust and you can get a lot of help from.
Dr. Erin Lee, what would you like to leave listeners with?
This is a medicine that's been around and time tested for over 5,000 years, way longer than modern Western medicine. And there's a reason why it's stuck around for so long, thousands of years of empirical evidence. And I think, that's observation and repeated results, and that is scientific method. I would throw away any kind of preconceived notions that you might have, or misunderstandings, or even ignorance, because you just don't know the reasoning behind it, and just try it out.
Thank you to Dr. Erin Lee and Dr. Robert Lee for being our guests for our Hanbang episode. A special thank you to Dr. Robert Lee for welcoming us into his home for this recording. You can follow Dr. Erin Lee on Instagram at workinprogressacu. Find her website at workinprogressacu.com. You can find Dr. Robert Lee at wellintegrativecare.com. We'll add their contact information to our show notes. Please follow K-Pod on Instagram at Korean American Story. I'm Juliana Sohn, your co-host, producer, and photographer. Catherine Hong is our co-host, producer, and editor. Our videographer and producer is Young Sun. Our audio engineer is A.J. Valente, and our executive producer is H.J. Lee. K-Pod is a production of Korean American Story. Thanks for listening.